How much fullness can you get with a breast lift alone? Well, let's talk about it. So every week I have patients who come to the office who are requesting to have more fullness in their breast. Usually that gives you more of a youthful appearance to the breast. Typically what they're talking about is a shape change, but a shape that's putting more of the volume of their breast up higher on the chest. And that's where the fullness is, right back at the top. So typically this is a patient where they're having some sagging or drooping with the breast and may need a breast lift to reshape the breast and put it back up on the chest wall. However, when we do that, we're always limited on how much of that volume we can keep and maintain at the top. And that's really the critical distinction between a breast lift and a breast implant. And I'm going to show you here with an example, okay? So with a breast implant, we can actually maintain volume at the top against gravity because the shape of the implant will maintain that for us, okay? Whereas breast tissue tends to displace to gravity, and it'll tend to fall to the bottom when we're upright, it'll fall to the side if we're lying on our back. And so that's one element to remember. So now let's go back to no implants at all. We're just talking about breast lift alone. So what determines then how much of that fullness will stay at the top of the breast out of clothes after your breast lift? Well, it actually comes down to many factors, but I like shorthand to say that it's essentially age-related changes in the tissue. So it's a tissue issue. So as women age, the breast consistency changes. Initially, it's more of a firm glandular tissue that maintains its shape against gravity. And then as the patient ages and goes through life changes like pregnancies or significant weight fluctuations, the amount of firm glandular tissue that's maintaining its shape gets converted to more of a loose tissue or a fattier kind of breast consistency, which tends to distort to gravity more easily, right? This is where the breast starts to droop south, or when we're lying on our back, it goes to the sides. I have two patient stories which I compare. A patient who's 19 years of age and has never had any pregnancies or massive weight fluctuations, and then a patient who's in her 50s and have had both. And I compare their breast lifts side to side. The patient who's 19 has more of this firm glandular tissue in her breast, so when I reshape it, it keeps more of that shape up at the top. Whereas the 50-year-old, when I reshape the breast, it is still lifted, it's minimizing how much of the fullness will stay up at the top against gravity. Now, you're probably asking yourself, well, which one am I? What sort of result might I get with a breast lift alone? Or, maybe I should consider an implant. Well, that's a great question. There's actually a pretty good way to tell. If your breast is starting to pancake flatten, okay, meaning it's droopy and it's relatively flat, then that's typically a breast that's not going to achieve a lot of upper pole fullness with a lift long term, okay? Now, you can have breasts that are droopy but not pancake flatten, meaning it's more round and projected forward, it's just hanging low. That's usually a better breast for achieving and maintaining upper pole fullness out of clothes. Now, if your desires are to have a lot of upper pole fullness, and maybe we have a breast that's a little bit pancake flattened, and maybe your goals are to have more upper pole volume, well, in that case, you may need to consider implants with a lift. And so you can check out our other videos for that content as well. If you're interested in getting a consultation with me to find out for sure and get a plan that's specific to you, feel free to give us a call or contact us on social media.